欢迎大家参加亚洲文化和教育协会主办的健康讲座。我是今天的主持，我的名字是孙小雪。First, please help me welcome the Student Council representative Serene Luo to introduce the Asian Culture and Education Society USA.
Hi, my name is Serene Liu, and I'm going to be introducing some of the volunteer activities and the things that.
Hi, my name is Emily Chang.
Hi, my name is Jessica Wu, and we're part of Asian Culture and Education Society. And we're going to tell you about what we've been doing in the past few months. We've been donating masks to hospitals and helping out COVID patients. And we're also going to continue to do this, and we've been making cookies and raising money to donate meals and more masks to different places.
So these are some of the volunteer activities we've been doing, and like volunteering at police departments, fire departments, and like House of Representatives. At the 2019 and in China, we took photos and made like photo albums of the people in China. And then we donated school supplies and money to the schools and taught the kids in China. And yeah, here's basically the same thing, and like us helping out other people. And yeah, so this is like some of our activities we've been doing, and this that's DI team, and one of our DI teams won 17th place in the global competition. And thank you for listening.
Thank you. Our last speaker is Ms. Shirley Wong. Ms. Wong is currently working as a public health educator at the City of Houston Health Department Office of Chronic Disease, Health Education, and Wellness. She is a seasoned health educator with more than 20 years of experience in health education in government, health sectors, tertiary education, and community service. Ms. Wong was originally a British-trained medical biochemist and has worked as a regional medical laboratory technologist in Hong Kong. She likes working in microbiology and hospital blood banks. Ms. Wong obtained her Master of Medical Science degree and Master of Science degree in Health Research Studies in Hong Kong. She was a full-time faculty member in the university in Hong Kong for 12 years. Ms. Wong is also an adjunct course instructor for the Texas A&M University Chinese Community Health Worker Training Program. Now, let's welcome Ms. Wong.
Thank you for giving me this opportunity. On behalf of Houston Health Department, we're doing this project Better Together and share my experience on how to become a community health worker. My name is Shirley Wong, and I am a community health worker registered in Texas. And to share with you how in the past years I have become a certified CHW community health worker in Texas after being certified and attended the Texas A&M CHW course and have become a public health educator in the Houston Health Department. And why I want to share this with you because there are so few of the Chinese CHW in the field, and we need these people, and we see so much inequality of health access, and we want to find the evidence to evidence-based to find your fields, to know the community cares, the community's need in healthcare, and then expose yourself to the field. Some people may want to jump in right now and take action, and sometimes you need to have some training, and this is why we are here to talk about it. How can you become a CHW? These are just the lay names. Some other names you often hear of our job, community health worker. Some people call them health educator, health advisor, health worker, health promoter. They're all the same. We're actually doing the same thing, but why do we have to be a community health worker? Because you know your community well. You speak the same language. You know the problem that's existing, and you know the ways in particular the culture, the economic status of your peers, or you probably know why what they're encountering difficulty in their life. When they're migrants, you probably have experienced it before. So we really need to have the same people working, serving the same minority. So community health workers definition. You have seen this slide probably before from the Texas A&M CCHW training program. I'm just borrowing that slide, so photo credits goes to them. Slide credit. People like to talk to the same people of the same race as a community health workers because you speak their language, because you are trustworthy, and because you understand their problem. They trust in you and they talk to you about their healthcare problems or their life problems in the community. So you may be able to help them because you're already in the community. So you're within easy touch. This is why we want to train some more people to be a community health worker. Some people work as amateur. 就是业余的意思。Some of them work as a career, like myself now, working in the Houston Health Department. Some of them could be just laymen. They did not have any medical background. And some of them already are healthcare professionals, like nurses and doctors. So whatever, the people have different backgrounds and people want to become community health worker, you're always welcome, no matter you're amateur, you want to as a career, you're layman or healthcare professional, they're all welcome. But this is the agenda I will go through in this coming 20 minutes. Second point is how do I become a community health worker by registration, by certification with the State Department of Health, and talk about skills and competencies that you must that is required of a community health worker. Understanding of the needs of the community by evidence. So what are their needs by evidence-based? And then I'm going to share my project with the Houston Health Department Better Together very quickly. This is what we do all day. We go and educate people. We do a lot of education material stuff and sorting them, writing them, translating them, bringing them out, having booths in the public. So we often talk to people in the community. This is a picture when we are in a church events, sorting out materials. And we do use a lot of materials from the CDCs. So CDCs, we use the materials. Sometimes we make our own materials. Sometimes we translate the materials. We are doing a project Better Together now about COVID-19 prevention. And we talk about, teach them how teach the community how to keep COVID status positivity low by keeping social distance, by using face masks, by washing their hands often correctly, and wiping down surfaces and getting tested. So we do all day, other than teaching face-to-face, outreach. We also do teaching online. So with the Texas A&M University CCHW program, every week the instructors meet up online, and then we will prepare for your course. So we do a lot of things online preparation, like making up classes virtually. This is myself teaching virtual classes now during the pandemic about the topic of slowing the spread on behalf of Houston Health Department. So we are constructing the course material, we're delivering them, we're teaching online, we're teaching in person, we're outreaching. This is the online course specially made for the Chinese people in Texas. It's a Houston Department Better Together online virtual class. We have provided these classes in COVID-19 prevention in English, in Spanish, and Chinese. So all you have to do is to, just enroll each of these classes, 50 to 60 minutes, and then you'll get live classes. So we're doing this since October. We're doing it in November and December now. So in these 3 months, we are outreaching the Chinese population and asking them to be educated and to know how to keep themselves safe during the pandemic. We translate all these materials into Chinese. 管理症状 in a class, one of the topic is symptom management. So we talk about it like in a live interactive way. And 还有另外一个 topic 佩戴口罩。所以 we are doing all these different topics according to the needs of the public. We also talk about how to wash your hands in another class. And other than myself talking or teaching online of these themes of Better Together, hand washing, we also invite the participants from the Texas A&M CCHW course to be health educators, so they experience. So we're training the trainers. So we are not only teaching the public, we're teaching people who want to become CHWs. Now, characteristics, you may want to do be a CHW. What characteristics must you have? You may have seen these slides as well. You must have a heart to help people. You must be trustworthy. You must respect others. You must be diligent. You must be creative. That is very important because situations do come up every moment when you go out into the field. So these must be the characteristics. And these were so true when I was in the course. I learned about all this. When I went out in the field, they all came up live. So what other skills do you need? You need to have critical thinking. You need to have ability to work with other organizations. We often have to outreach to the directors of many other NGOs, churches, schools, and the community leaders, and talk to them and tell them what we offer, and then let them approve us, and then we could talk to their little communities, bring in our materials and share with them. So all these are required. All these tasks or duties are required. And what do you need? You need to have a very critical mind and ability to explain your rationale of what you're preaching and your strategy. You got to have some strategy in health promotion. And this is how you get certified with the Department of State Health. So you can click into this link. This is where we get certified. And with this certification, you need to have done 160 hours of the training with a instructor, which is a certified instructor. For example, Texas A&M University is a instructor hold an instructor course in the A&M CCHW training program. You could finish 160 hours with them, and then within which you should have 20 hours of practicum. They approved it, they signed it, and then you reach a certain you finish all the homework. The requirements is you finish all the homework they've assigned, and you reach a certain mark in each piece of homework or on average, and then take the materials to the certification to be registered here. So 160 hours and the 20 hours within the 160, you are ready to register. So the registration period takes about 2 to 3 months, and you will get your certification, and then you become a certified. So this Texas A&M course is actually currently taking in students. So until December, we have this course for 3 months. It is now November. The program will end in December 2020. So if you're still interested, you can log in and you could catch up with us and try to see if you can finish the course in December the 30th, by the December. So this program is free. It is held by Dr. Liz Chan. She had her instructors talking about this course last time. So I will leave you to review the YouTube videos from last week to know more about it. Now I'm just talking about my experience, and I have learned from this program and become more competent in the core capacity, the 8 core capacity that is required of all the CHW. We become more communicable with the community. We have good communication skills, interpersonal skills, service coordination skills, capacity building skills, advocacy skills, teaching people, teaching health education, and organization. How do you organize your outreach? How do you organize an event? Knowledge base on specific health issues like cancer, like the 5 most common type of cancer in Chinese we've been serving, and also now COVID-19 prevention. Now, with what kind of personality type must you have? A lot of my colleagues are advocates. I myself a protagonist, so that I jump into project very quickly. I am advocate too, and you got to have some listening ears. You got to be a good public speaker. You know how to ask effective questions. Know how to analyze your strength, weakness, opportunity, and threats. So you know the culture. You are sensitive to cultural issues. So you know HIPAA. You will not disclose your client's information. So all these personality types and soft skills are required of a CHW. You can check for yourself. You may already have very good skills, and this is why you may be interested in becoming a CHW, especially when you are a Chinese person, that you want to serve the Chinese community, and you speak Chinese and English, and you can outreach and reach the people in need. Okay, last 2 weeks ago, this is October the 3rd week, we had a National Health Education Week. This is national-wise, and the theme was health education as catalyst for change. So we go out, we educate people, and this is the only way by education we could change the behavior, that life style behavior of people, and to become more healthy. It's only by education we can change them. So they contemplate phase, they might take action later, it may become a habit. It takes a long time to change a person's habit, but it's only by education. So educators get the credits. Now, this is about how you go out to the field and find out about where is the need. So we want to minimize health inequality. Health inequality exists everywhere, and especially when you don't speak the language, you don't speak English, you may be less accessible to some of the healthcare service. Maybe this is why we need to identify where you could help. So maybe a person does not have the transportation to go and see a doctor. Maybe they don't have the education, they don't speak English, they cannot read the healthcare leaflets. Maybe they don't have a job, they don't have income, they don't have health insurance. That's why they don't see a doctor when they're sick. So as a community health worker, you have a lot of information to give to these people to minimize the healthcare inequality. So we want to find your field. If you're a new community health worker, you may want to identify your field. This is a diagram showing how people's health status could go upstream this way or downstream the other way. The worst thing is mortality, death, diseases, death. We don't want to go down this way. By our effort in helping joining into the workforce as a community health worker, we want people to come upstream. So by providing them more assistance to minimize health inequality, by more of institutional power, by minimizing social inequality that's existed, we want to bring the health status upstream to be more healthy. So determinants of health, we want to promote all these determinants and let them be, the society be more healthy. So the living condition may vary according to your financial status, your health status, or where you live, whether you have transportation. These are all the factors. Living conditions matters, determines your health status as well. We want to help people with all the determinants to minimize inequalities and go upstream. So because of time, I am jumping into this, finding your territory. These are just some few examples of where you can find your field. But these are according to the statistics in the inequality inclusion, inequality and in health disparity in 2019, which is available, is a report available from the Houston Health Department. You can find your own territory. Did you know that HIV and AIDS rate is particularly high in the area, Houston area? It's so much higher than the national rate, 14.7. Houston has 27.5 people having AIDS, contracted AIDS, HIV per 100,000 population. So it's a lot higher. Are you going to work for these people? Or hepatitis C is very has high incidence in people about 50 years old, and in the past 10 years, it's been rising. Syphilis, especially they found in male. Syphilis is a communicable disease. They could spread it around by having sex. So it's more prominent in African race men. So these are just examples of how you could find out where is the community need. Maybe immigrant. There's lots of immigrant, 1 million of the 7 million total population in Houston area. So how do you help them? What is the need? What are the children's needs? So you could go and help them, knowing some of them couldn't speak English or Spanish. This is how when you go out to the field, I have joined the Houston Health Department. In the past year, I have been working on this Better Together project since July, August, September, October. We've been going out educating people to do the hand washing properly, wear the face mask, keep the social distancing, and getting tested. This is the back of our t-shirt, and we preach these messages in the public. This is our team. So actually we have a team of 40 something people, our street team. We do go out to educate people by outreaching, a lot of outreaching. So so this is our Connect newsletter. So we go out to do a lot of these activities, and we find out some neighborhoods. So these are some photos of our outreach. We go to school lunch cafeteria. When they prep the lunch, then we will distribute our health education material into the lunch packets. So we go to different regions of Houston. We go to Northwest, Northeast, Southwest. We are even going to the Mexican, my colleagues going to the Mexican consulate to preach our messages to the Spanish-speaking people, because they are a majority here. There are many of them. So if we still had a Chinese consulate, then we could find another opportunity to go, but there isn't one. You see a lot of billboard. We are promoting these COVID-19 prevention by billboards, by health leaflets, healthcare agitation talks, and that was the Health Education Week. So very quickly, I'm going to show this idea of our project. Thank you. So this is all we do in the Better Together project. We're going out to educate people. We do it in different ways. Okay, we do billboards, and also Houston Health Department, we have a lot of epidemiologists trying to work out the statistics. And in the greater Houston area, this is Houston, city of Houston, we work out active cases by zip codes. And the darker blue areas are the heavily infected areas, the good areas with COVID-19. So you can see some of these Southwest or Southeast regions, and some of the darker ones here, they are the heavily infected areas of COVID. And this is by evidence based. We have the statistics, and we go out to these zip codes to reach out to them. And this is the very recent rates in October, the 2-week positivity rate. So we look at the darker sort of green areas, looking at the positivity rates, and also we look at the death rates as well. So perhaps say zip codes 77072, 77036, 77088. These are the areas in Houston with high death rate, with people number death less than 52. But these are the heavily impacted areas that we specifically want to go out to these zip codes. Positivity rates. So in the month of October, so we're seeing the trend coming up. It was a surge in June, July, coming down to August. The aim of the mayor's of the whole project is to have Houston COVID-19 positivity rate coming down below 5. So Mayor Sylvester Turner wanted to bring down the positivity rate to 5%. Now we're in November, and this rate has been coming down, but not exactly below 5. It has been fluctuating between 5 and 6. So we are doing our work to bring it down to 5. And we do not want to see when schools start, when business and when churches start, another surge again. This is why we're here educate the public. We do not want to see another surge, because it does. By the way that we're doing, sometimes we already located the high death rate zones or high positive rates. We go to canvassing in this estate. If I found an estate with high COVID-19 cases, by the wastewater, we have people testing wastewater in different estates, and then we come back with the statistic figures, and we know this estate, in this estate, there are heavily, then lots of cases. So we go out to preach to these people in the estates as well. If we know they're heavily infected, we use these materials, we print them. We go to the Chinese community, which was the zip code 77036 in Houston. So I went out to the Chinese community as well, because it was one of the affected area, heavily affected with high positive. We went to Chinese community, talked to the Chinese. We're working with the sheriff. We're working with YMCA. We're working with Spanish church, speaking churches, and we're working with many different people. So as a community health worker, our job is very busy. We do have to have a very good organization skills, and even look at this picture. What is wrong with the car? Can anyone notice what's wrong with this? And this lady seems to be happy. And this gentleman is kind of, comforting her. If you work out, so during one of our food drives, we had this English, she does not speak English. This lady's Spanish speaking, but she came up to us, my colleague who spoke Spanish, and asked for help during a food drive. So we're educating people, and she became to trust us during the talk. And then when she went back to her car, she found that she lost her keys. She locked her keys in the car, and she had left her baby inside. And she came up to us in Spanish, panicking. What should I do? What should I do? We suggested her to call the police, but we didn't, because she didn't want to. So in the end, we found this gentleman who had a hammer. He found a hammer, and this gentleman helped him to break the glass. Do you notice the glass is broken? And we helped her to rescue the baby. And, she was happy. In the end, she only broke the smallest window in her car. But this gentleman actually came from the food truck. He was the food truck driver during the event. So we have different things arising during our education, and you've got to be very flexible. Working with different churches, food drives. So these are materials. We only have about 1 or 2 minutes to talk to the drivers when they are in a drive-through. So it's good opportunity when they are waiting. So we provide free testing, tell them where they could be tested for free, the number, the website. They don't need any documents, no appointments needed, but where do you find out the clear and nearest location and the closest one to them, to just to educate them. These are for free, and you've got to know when the food drives are happening in your city, so that you could work together with them, jump in with your education material, going through these food drives, talking to people driving in. You have a good 1-2 minutes to educate them. This is my part of my team, having a booth in a church. I'm working with different churches, even if they speak Spanish. So lots of cars in the drive-through. Usually we have 200-300 in the morning. So in churches, working with churches in drive-throughs. So as a conclusion, to be a community health worker, you have to prepare yourself. How do you prepare yourself? You go to a certified course, go through these, get your license, get your credentials to be a CHW certified in Texas. You could also volunteer yourself to some of the NGOs. Working by yourself is no good. You got to hook up. 千里马也是又要好的白乐，这是中国人的 saying. Chinese saying, you need to have a good. If you're a good horse, you got to have a good rider. So you may want to partner with somebody who is already very organized organization, and also use evidence-based to find out where's inequality. Where's the need of the healthcare need of your community? with evidence, find out where is it most needed. If they don't need it, so or there is well dealt with, perhaps smoking is come down a lot. So you may want to work in your new fields. Also expose yourself, do outreaching when and take action. So find your own field, an area that you could serve, you feel comfortable with, you can speak the language, or they appreciate you have the need the help. There are many fields that are needing community health workers amongst the Chinese. So this is my presentation and how you could become a community health worker, especially when you're Chinese. So I hope it helps. I'm not very experienced. I've only been doing this in the past year, but this is my my experience, and I hope you will find your field and you'll find your service pretty soon by doing that. Thank you very much for the opportunity, and I thank the Houston Health Department, because this Better Together project has given me the opportunity to serve the community that I always want to serve in, and they are exposing me to a lot of other outreaches and exposure, and it made me a better, more experienced community health worker now. So thank you all, and I hope you find your field soon. Thank you so much. Have a good day. Bye-bye. Thank you.